good evening. Welcome to another episode of Let's Talk About Mental Health. I'm Nels Kloster. I'm an addiction psychiatrist and I work in Southern Vermont.
And I'm Robert Stack and I'm a licensed alcohol and drug counselor.
Right. And again, we have postcards that have been addressed and stamped to send in questions to us if you happen to find them around town, around the state at turning points. We also take questions by our Facebook site at www.facebook.com/letstalkvt or at our email account, which is questions@letstalkvt.com.
All right. Well, you know, one of the things that we wanted to do, and we're not going to be answering any questions per se, but I do want to talk about something that I think goes back to when we first started this show. And one of the things that we used to talk about, I talked about, was mental illness. And I spent a whole year talking about the mental illnesses and drug addiction, alcoholism. And one of the reasons you joined me and became part of it. And we said, we want to say, let's talk about mental health.
Right.
And let's not focus on the illness. And let's talk about what it means to get better.
Right.
And I really like that approach, and I appreciate that. But I want to give a little background, and maybe we can talk a little bit more about this. And I'd like to hear what you believe or think. You know, when I started 30-some years ago, and one of the things they taught us, and it was mostly alcoholism, very few opiate addicts at the time in Vermont. I worked on a 25, 26 bed unit, and I think maybe less than 10% were opiate addicts. And almost always there were medical professionals. But by and large, most of them were alcoholics. And one of the things that everybody sort of focused on was that alcoholism was a disease, and that it was an illness. And that they would use a model, and they would say that it was a threefold illness. It was a physical illness, it was a mental illness, it was a spiritual illness. And that recovery assumed that one got abstinent and became involved with 12-step programs. And that was pretty much the approach to recovery. Now, I also had the benefit of being on a unit that was considered a dual disorder unit later on in my career, and they focused a little bit more on the psychiatric. But in the very beginning, I worked on what they used to call a 28-day unit.
Right.
And that was my belief, and that was my training. And the thing that sort of strikes me, though, as I got more and more involved, I understood that it was considered a mental illness. You know, the physical, the detox, that was the withdrawal syndrome. But the diagnosis itself, what the insurance company was paying for, was a mental illness diagnosis. And also one of the things that I found, as I started exploring different ways for treatment and working with folks, in addition to recommending 12-step programs, I also started talking more and more about what I believe was a very good form of therapy, cognitive behavioral therapy. And so I used to tell people that one of the reasons it's a mental illness is that at some point you will have a trigger event, a person, a place, an emotion, a feeling, and that trigger event would have you would react to it, and that reaction would be like an impulse, if you would, and it would be based on this core belief system. So in the little cognitive thing that I used to do, I'd say if you had a negative core belief, something about yourself, and an incident occurred, and that triggered that negative cognitive, what we would call cognitive distortion, a negative, that would then produce a craving, an urge to use. And then there would be the action, and the action would be a behavior. It would be, you would do something, you would feel something, it was a reaction to the stimulus. So I don't know if I'm getting this right. In other words, there's an event, there's a reaction to the event, and then there's the outcome, and part of that outcome. And I said it was a mental illness because people gave themselves permission to use. In other words, they would they have an urge to do it, and they would talk themselves into doing it. They would give themselves permission, one more time, or I need it, or just this time, this is the last time, I just got to get through today. Now these are people who are aware that alcoholism and drug addiction is an illness. So excuse this long introduction, but I was very comfortable with that. It was very sort of, here's how you need to do this and you need to say. But one of the problems I've been having lately, and I look at it more and more, and I've known many people in treatment that I've worked with, and so they come in and they get a diagnosis, and the diagnosis is a mental disorder. And they get detoxed, and they get told, don't drink anymore. Now, go to AA, go to some counseling or therapy, maybe even go on medication if that's appropriate. But by and large, I don't see him as mentally ill anymore.
Yeah.
I really don't. And you know this because I mentioned it to you a couple of weeks ago. I was reading a book about a psychiatrist, written by a psychiatrist, and it was just one paragraph, maybe one page. He said, I don't believe substance abuse disorders or mental illness.
Right. Yeah.
He said, I don't think it has that quality. He says, I think it's more, if you want to call it a disorder, that's okay, but I wouldn't call it a mental illness.
Right.
And he said we ought to approach it the same way we approach cigarettes, the same way, people, in other words, like it's a bad idea. It's not a good idea to use heroin. It's not a good, all the negative consequences. And I've really wrestled with this. I mean, it's because I was sort of trained to know this.
Yeah.
You can stop drinking. I mean, AA says, their favorite words of advice for a newcomer is don't drink and go to meetings.
Right.
Now, they don't tell you how to not drink. They just say don't drink.
Yeah. Yeah.
They assume it's within your ability. And they tell you, literally, they say, a day at a time. That's all you have to do is not drink for one day, and sure, you can do that. And if you have to, do it for an hour.
Yeah.
Break it down to
Yeah, and what we're talking about is we're having doubts, you and I, about the prevailing paradigms in our specialty, right? The more we sort of learn, and the more we work with people, and the more we read other opinions, we're starting to wonder about this whole idea about, is this an illness, is this a disease, right? And I know that, my training's been sort of a shorter period of time than yours, maybe 10, 15 years. But addiction was always this sort of other thing. There were the mental illnesses and there were addictions. And then it was like, no, these addiction, alcohol is considered an addiction. So a drug is a drug is a drug. And then but also that the addictions are a mental illness. So if you talk about mental illnesses, you talk about types of mental illnesses that includes opiate addiction, it includes alcoholism, and these are all one thing. But then there's been so much as sort of, I always wonder about these things, do they pass the common sense test, right? Does it just plain make sense to somebody who's thinking without all the indoctrination on top of it? And this whole idea about co-occurring disorders is what really has me sort of less satisfied with the prevailing way of looking at things, because what I found in my experience is that by saying co-occurring disorders, you're not saying co-occurring disorders with, say, bipolar disorder and generalized anxiety, or with depression, ADHD. When people say co-occurring disorders, they're talking about the addiction disorders and some other mental illness. We're talking about depression and alcoholism. We're talking about bipolar disorder and cocaine abuse. And so there's still that dichotomy, that separating of addiction as something else. And when you look at all of mental health and sort of the way the diagnostic and statistical manual, the DSM, is structured, one of the criticisms with succeeding versions of this has been that there's nothing that you can clearly grasp that makes it an illness, like say a cancer, for example. You can see the tumor. If you break your bone, yes, you can see what had happened and set that. If you get infected with a bacteria, you know that if you get giardia in your drinking water, there's this diarrhea and there's this stomach upset and everything that goes with it, course of time. It's very specific, and one of the difficulties with mental illness is we have none of that specificity. And so over the course of time, it has had a very sort of cultural component to it. Maybe even you could call it a fad. And for example, folks have talked about, for example, homosexuality used to be considered criminal, then it was considered an illness. And now, you know, we're legalizing homosexual marriage in 3/4 of the states right now. So I can't really sort of, I've always had this doubt when I've learned this whole, you know, paradigm around what is mental illness, what is addiction, recognizing that just like now how we look back on the silliness or the cruelness of certain diagnoses and ways of looking at things, we have to realize that the things we believe now are going to be laughed at in 10 or 20 or 50 years as being, well, how could they have mistaken this you know, popular ideology for being an actual illness? So I'm not buying it anymore. I'm in doubt.
Yeah, and you know, I used to tell patients, and I used to share with them, I say, you know, there's nothing wrong with the substance. There is no mental illness inside the substance.
Right.
Opiates are fine for patients who are in pain. Patients with cancer who are dying or broken bones. Morphine is great. You know, there's nothing wrong with it. There's nothing wrong with a glass of wine. There's no alcoholism in that wine. It's in the person. It's in the person. The illness is in the person. But even then, I doubt it, because when I see people who come in, and it's easy to see that the withdrawal, right? You see the physical part, and you see the crazy behavior, and you see the things that they've done, and you think, well, you know, they're not, you know. But you can also look at those individuals 6 months later, a year later, 2 years later, 5 years later. They're not mentally ill.
Right.
I mean, and I guess, you know, according to the rules of the game, what you write down is that the disease is in remission.
Right. You are always an alcoholic. You're always opiate dependent.
And it can be reawakened with one drink. And I've seen it happen over and over. I hear people come back in the hospital and say, yeah, I started drinking, and here I am again, you know. So, but I don't think it was the 6 ounces. I think it was the 6 ounces in your brain, in your head. And so that's where I get sort of confused. You know what I mean? I mean, at one point, like this is why it's so strange for me. I mean, I have to sort of think about it, that, you know, I buy AA, or that you're powerless, and, you know, and your life is unmanageable, and you have to surrender, and you can't drink, and the first drink gets you drunk. I got all that, right? I understand that piece of it. But there's a part of me that does not see it as the same as schizophrenia.
Right.
That, you know what I mean? I really don't see it the same. And I see alcoholics who are able to stop using. I see opiate addicts who are able to stop using, and they do stop, and they lead good, positive lives. And I think on some level it's a choice, it's a decision. And I get worried sometimes, and maybe I'm just becoming conservative in my old age. I mean, it's possible, but the idea that somehow having a disease takes away responsibility for behavior. It sort of doesn't acknowledge that, no, these are choices that you've made. Yeah. Now, I don't know if that's fair, but once you've been to treatment, once you've been diagnosed, the next time you use, it will be a choice. Right. It will be a decision. And I mean, I'm all right with them getting medical help and getting treatment, and I guess you need to have a diagnosis to get that. But I also think it's kind of worrisome. Yeah,
I mean, part of this is how do we make sense of this, right? Because in a way, you know, one thing that's criticized often of it being sort of a disease model and being a brain disease in particular is that there's this element of it's out of your control. And if it's out of my control, well then really what responsibility do I have for it? But when you look around at the majority of people who've done this, it is not out of people's control, right? There are people who are actually in the throes of using. They will ration how much they use to get through until their next fix. So there is that element of control there. People do make choices to stop all the time. So I think that the question might be, what is it that causes, say, people to make such bad choices? And just making bad choices make this an illness or a disease?
And why is the solution for a lot of people spiritual?
Right.
I mean, quite frankly, I mean, a lot of people get recovery in programs that are basically spiritual. I mean, they're fellowship. People get together. They support each other. But ultimately, they're spiritual programs. And so, I mean, is that true? You know, I mean, it's very dangerous for you to say, well, addiction is a sickness of the soul. Yeah. People throw up their hands and go, we're not going there, you know? I mean, no, you know, it's like, exactly. We're not good, but maybe it is. Yeah. Maybe it is a sickness of the spirit. Maybe, you know what I mean? Like, and there's a part of me that wants to say that. I mean, I want to sort of, it's very hard. I mean, I've been indoctrinated. I've got my master's, I've been trained, I've read the books, you know, and every once in a while I'll pick up a book that says, you know, we're over-diagnosing America, or the addictive disease, or the illness of America. You know what I mean? Where they sort of question it, and I find myself defending it. I defend I've been doing this for 30-some years. You know, but I'm telling you,
I was with the group just this weekend, and we're watching a video that was criticizing the medical model. And even though I agreed with this, that you know, you're medicalizing things and making a diagnosis and prescribing medications, it's a very sort of you know, negatively focused. You have an illness, and we do this pill and this medication. It misses the richness of becoming well, which I think maybe is the piece of the spiritual approaches with, say, with AA, and why a lot of people are revolting against psychiatry and the marriage with pharmaceuticals, and a diagnosis equals then sort of a path down a lifetime of medications, and that these are not helpful for most people most of the time, and to use the extent that they are actually detrimental to many folks, even with, you know, severe and persistent mental illnesses.
You know, I took a class, a course on DSM, the new Manual 5, you know.
I refuse.
It was huge. I mean, you know, hundreds of symptoms, if you know, lots of diagnoses. And there's so much of me that sort of worries about it. I mean, very educated people, very smart people, I mean, degrees and everything, and they have clients, and I understand this. And there's the insurance businesses involved, and pharmaceuticals are involved, and hospitals are involved. I mean, it's an industry. I mean, you know that. Yeah. And it's okay. Everything's okay. People are getting care. And then, you know, I have this sneaking suspicion that, you know, on some level, we're sort of missing it. And I don't mean this in a mean way. It's like, as you know, I'm a veteran. We're coming up. And I understand that war changes people. There's a rumor that it changed my father. Right. He went to North Africa and Sicily and Italy and World War II, and my mother said, you know, he was a different man. Anyway, with regards to that, did he have PTSD? Gee, I don't know. I don't know about that. Did he have nightmares? I don't know. He got up and went to work every day in the post office, you know, and he drank every day. I mean, I'm not going to make a judgment about this, but I get so worried about it that I was reading a book by a Marine. He gave a talk at the library recently. He talked about, and he was talking about what has happened to him in the war, and his life experiences, and how he coped, and how he came home to this society. And I guess he is eligible for the diagnosis of PTSD. I mean, you know, I don't want to make a diagnosis on a book, but I don't really believe he was mentally ill.
Right.
I mean, I'm sorry. I mean, you know what I mean? I understand why you would use it, you know, but I don't see him as being mentally ill. And there's so many other factors involved.
Well, and there's this, and one of the criticisms too is that there's this intense effort in labeling and naming things and various types of symptoms. It seems to be getting to the point where it's not just naming things that are, say, disorders and that are descriptions of, say, you know, malfunction, but rather we're almost getting to the point of putting a label of disorder onto more normal sorts of behaviors. I mean, we talked once about, you know, ADHD being a protective mechanism, or actually great for sort of, you know, hunter-gatherer sorts of people, not a disorder in that setting. And it seems to be sort of over the top that so many facets of, say, a normal human experience are now being given a label and it's pervaded its way through the vernacular. You know, people are, my ADHD, you know, my bipolar disorder. And it's come to a point now where I used to get sort of critical about that. Well, you know, what makes you think it's bipolar? What makes you think it's ADHD? You know, how does that ring true with you? That it's that, because bipolar is really this, and it's watered down. And now I'm just realizing that the DSM and psych speak has pervaded normal language.
Who was that guy that we had on last year? We were talking
Robert Whitaker.
Robert Whitaker. I mean,
yeah.
But he said one of the things is a concern. He says that the drugs do help with the symptoms.
Yeah.
But he seemed to prove, or at least, you know, said there was evidence that using medication sometimes will increase the severity. How do you say this about relapse? In other words, if you, the short term the meds are effective, but long term it looks like they're not that beneficial.
Because they alter the balance in the different nervous chemicals in the various receptors, and they put it out of balance. And so the longer the medications, the more that balance becomes out of balance. When the medications are gone, then that gulf, that discrepancy there in the system, that amount of being out of balance becomes very evident then when the medications stop, which seems to be a worsening of the illness, when as really is probably a symptom of the medications themselves, if I recall what he was talking about. And
yet, I do believe in talk therapy. I do believe in one-to-one. I think it's so incredible. And I think in some of the ways that we've done this is that we've decided with the illness that the medicine is the answer. And the problem is, and I, you know, very briefly, you know, was involved in some outpatient counseling, and one of the things that you would see is that there was a tremendous urge for patients to get medicines. And when I told them I couldn't give them medicines, I had 2 or 3 of them stop coming. I mean, quite frankly, I mean, they really saw the medicine as the answer. And I'm a firm believer in sort of reframing problems, taking another look at something. You know, learning to accept yourself, or learning to love yourself, or be open, or just look at something in a different way that allows it to be bearable, that you can live with it. You know what I mean? I still think that. I mean, I still think that for veterans, I mean, I don't have the answer for PTSD. I don't know what they should do, but I'm not clear that medicating the symptoms. When I read this book, medicating the symptoms doesn't seem to be, at best, it would give you an opportunity to talk to them. Maybe that's the only thing I can think of. I mean, I don't know how else to put it.
Yeah, and it's a matter. I mean, I think one thing I don't want it to sound like we're talking about here ignores the fact that when people describe themselves in terms of psychiatric diagnoses, or they go to seek help and seek out medications or go to talk therapy, obviously they're struggling or even suffering. And my feeling is that so much of what I've seen in practice with people seeking medications, or people with you know, struggling with addictions to various substances, wanting the label of bipolar disorder or depression, is that it is causing them to be passive in the treatment. See, I've got that thing. I have it out of my control. It's a disease. There's nothing I can do about it. Which, you know, we know from wellness, you have to work at it. And you have to make changes. You have to take responsibility for this. And I'm afraid that what a lot of the system has done now, by this focus on, say, what do you call a medical model, focusing on illness, fixing it with medications, is that it's ignoring the fact that we want a quality of life. We want a richness to our lives. We want good relationships. We want satisfying activities. And I'm afraid that the current model looking things does not move us towards that.
Right. And I don't know if we really, I think at some level, most folks, I hate to say this, but they don't, they see so much advertisement for like alcohol, advertisement, I mean, advertisement, doctors, what is it, medicines, you know, if you sit, you ever sit at home, watch certain programs, I mean, oh my, you know, they know that a certain age group is watching, you know, Jeopardy or something, and they had ads just for us old people. You know what I mean? It's like, no.
Yeah, Lawrence Welk and Geritol, if anybody remembers that.
And it's this idea that you take medicine and you'll get better. The medicine is what you need to do. And I think on some level, and even now, I sort of worry about it that, you know, one of the reasons, and I firmly believe this, that Vermont had such an explosion of opiate addiction is that, A, they were naive about the results. They were naive about what happens to opiate addicts. Like when I was growing up in Newark, you weren't really naive about what happened to junkies, opiate addicts. I mean, it was pretty clear. You could just see it. And this was, you know, I mean, you knew what you were getting into. But I think in Vermont what happened is that opiates showed up in pill form.
Right.
And they showed up as medicine.
With the sanctioning of the doctors prescribing this,
you
it
know,
must
or
be okay.
somebody had, or somebody's medicine, or some, you know what I mean? It was like, and I can't pinpoint any one ad or one cultural moment where you decided pills were okay, but I think there was a naiveness to it, and it was okay to take a pill. It was okay to take an opiate, and of course, over time, everybody woke up to this fact that opiates, pills were killing people, and they tried to, you know, turn off the faucet. But at that point, a lot of opiate addicts then went to heroin.
But I mean, too, and starting with this, I mean, you do these things because they feel good. And this is not about an illness or disease. This is how we've evolved, that we do things that feel good. So the one argument, and again, you see this in sort of animal studies too, when they try to talk about sort of, you know, cocaine as being, you know, hopelessly addictive, and that rats will push the lever forever to get that. What they're not publicizing as well is that these rats are not put in enriched environments. These are rats in a cage with no other option but the cocaine and maybe some water. So of course they're going to push the lever. When you put them in there with other rats, when you put them in there with toys and exercise and things to seek out, they're not interested in the cocaine. So there's this richness of environment, you know, sort of positive things that we know make us well. Right, having our relationships, having purposeful activity, that these are things that protect us against that. And many times the people that are getting involved with the drugs, they don't have those sorts of things in their life that help them to feel well. And then they make this choice, right, towards a substance which, you know what, now I feel good. I feel better, everything is fine now because I'm awash with this pleasure that comes from this substance.
And I gotta say, you know, you work with a mentally ill in the Pathways program, helping them to get housing. Right. I saw a program last week where they were interviewing people involved with the recovery turning points, and they were making a case for employment, giving these people jobs, work, the importance of work. And so when you think about some of these factors, sleep, exercise, work, a home, people caring about you, someone to talk to, all these things come together and you see people get well. And that, to me, that sort of draws in the diagnosis into question. Yes, the illness, or whatever way you want to talk about it, was there, but, you know, it's so many other factors. If there's so many other factors involved in the recovery, don't you think there's a lot of factors involved in them using?
Exactly.
You know what I mean?
Of course there are.
So, and is that really what you want to say when you say somebody has a mental illness? Is that what it is? And that's why I bring this up. And I don't mean to be sort of like I'm smarter than you know, a million other practitioners. I'm not. But I just say, I wanted to say that, you know, I wanted to use this program to say I had doubts about it. I question these things. I don't quite understand it totally.
Yeah. I think if you're getting the message that you do not have a responsibility for your wellness, that you're a passive participant in your health, then there's something wrong with that. And I'm afraid that the current system is not focusing on wellness and what it takes to be well, but rather has this very negative passive approach, and I don't like it.
Right. Methadone clinics, Suboxone clinics, are just tools that people should be using to build a better life for themselves. That's, I mean, that's really all. I mean, I think that. It's not the answer. It's part of the answer.
Yeah, it's a tool towards the answer.
Yeah, I think so. I think that's fair.
Yeah.
Okay.
Boy, I hope we didn't go too far afield with this. I mean, getting towards sort of philosophical discussions about this, but thanks for putting up with us tonight.
You'll forgive me.
Yeah.